That's pretty cool. Well, welcome to the podcast. Hi, everybody. It's your host of Freedom to Fight, Anura Mathis, and I have an exciting new guest on my show today. Dr. Licuanan is a psychologist, and he specializes in substance use and abuse, something I'm very interested in talking to you about today. He's released a book recently. It's called How to Get Your Resisting Loved One into Treatment. Also, you train in BJJ, lots of things, and compete. You're a competitor.
Stop. I want it. I got it. 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 I want it.
I'll go ahead and turn the mic over to you to introduce yourself to my audience.
Thank you so much for having me. I know I had reached out to you on Instagram, and thank you for responding. And I always love these opportunities to spread mental health awareness, and I really appreciate and value when people respond back to me and say, "Yeah, let's talk, let's collaborate and spread the message of mental health awareness or substance use issues or family dynamics." I really appreciate you reaching back out to me. I'm a licensed psychologist practicing out of California. I have my PhD. I specialize in insomnia. I've worked a lot in treatment, residential treatment, intensive outpatient with people with pretty significant mental health acuity, with also substance use disorders. I also specialize in family crisis intervention, in which the book is focuses on with family members who have loved ones who are resisting help, and they don't think they have a problem, or they think they can manage their substances, and families are desperate. And so I've developed this book as a strategy guide to help family members with knowledge and skills and still coming from a loving place, and there's still hope on the family level that there's still things you can do to get your loved one back and help them get on a road to recovery.
I think that's quite beautiful and very needed prior to the pandemic, but especially now. People lost a lot of their support systems because we couldn't meet in person, and put a lot of people at risk. So I'm excited to talk to you about that and all of your other work. So your book was released in May, and so the book is geared towards families that are trying to get their loved ones into treatment. Is that right?
As I was writing the book, I realized that it can also work on the individual level. These are people who are struggling as well. And where that came into play are when someone is getting help in a path to recovery, I outline some of the most consistent factors that differentiate someone with a strong recovery program and those who have a weaker recovery program. And now that information comes from the 15 years working in my field, nearly 20 years working in my field, and almost 13 to 15 years working in residential treatment for substance abuse and mental health. And after a while, you see these very common attributes across family dynamics, across individuals, and you're able to see a better picture of who continues to progress and who are those that do not. Mm-hmm. And so I talk about those resilient and robust factors that are able to differentiate those people that lie on that recovery spectrum. And so yes, for individuals as well, if let's say they get help, what are some of those attributes? For example, having a strong fellowship, continuing to be open to direction, continue to maintain honesty, are those really crucial elements that really show who continues to be successful. And so yes, on the family level, individual level, I'm really happy with how it turned out being quite comprehensive in that regard.
Certainly. I'm interested in reading your book. I've listened to and read other substance abuse books or addiction based books. So this is written as like a self help book. It's not like science literature and or science heavy rather in
Yes.
the book. Yeah. Go ahead.
That was the main intention. The main intention was to create sort of a timeless manual, meaning that you pick this book up 10 years, 20, 30 years from now, and the interventions and the knowledge are still going to be pertinent and applicable.
Mhm.
Is because 50 years from now, depression is probably very similar in its presentation in a general level to it is today. Depression can look very similar 10, 15, 30 years from now. Yes, maybe there may be some changes in our treatment approaches and some other interventions. However, the presentation is very similar, and that goes along with, in addition to depression, that's anxiety,
Mhm.
that's post-traumatic stress disorder, that's substance use disorder, and so forth. And so that's what I want to create, and what I wanted to do was not let it be heavy in jargon, medical, psychiatric, psychological jargon, and I don't want to have research in it, because 30 years from now, seeing something from 2024 is going to seem dated.
Yeah.
However, the ways that I've gathered my data was working in the field. I've worked with hundreds upon family dynamics, hundreds of individuals on the residential level, the private practice level. I also facilitated a support group for almost 15 years, and and um, like I said, you see these consistent factors. And I also had about 18 people review the book and assess it on things like comprehensiveness, practicality, um, usefulness. And these were what we call subject matter experts. Some of these were psychiatrists who work in addiction, psychologists. I had marriage family therapists, social workers, people who work in support organizations, and I even had some family members and individuals who navigated through their own treatment and recovery and provide really, really great feedback and insight. And I made those adjustments to the book. So that's my way of really validating and substantiating the information on that level. So,
And what does that conversation with your kids look like? I mean, how do you even open that up? Because the second a parent might want to have that convo with their child, they shut down.
Yes. Well, what we have to notice with kids, the reason why they're not coming forward, is there's a lot of shame.
Well, that's really exciting. I mean, having peer reviewed research, papers is crucial to our communities. And I I don't know what you know about me, but I practice in therapy as well. I coined myself as a trauma therapist, but I'm seeing different responses to that type of title because trauma is a part of most of our lives. I mean, most people have experienced some sort of trauma. However, I feel like um, I think that some therapists are not putting the importance of trauma in their work. So calling people trauma informed, and it really should just be this is the general basis that every mental health professional should have in helping people. Um, my background is in um, therapy and psychology and trauma, and I started my professional career in working with foster care children, and that had high behavioral care risks that were violent and would run away and things like that. So I worked on site, but I've worked in residential treatment facilities with men um, and other and also led support groups as well. I just don't have a ton of experience specifically in substance abuse. It's really just kind of an overall mental health care facilities that I was working for and connected with. So I'm curious, what came
Jiu Jitsu
first,
has
your
helped my
path
mental
to
health and
psychology
growth.
or your path
Specifically, when I
to
started competing,
BJJ or
I
martial
was
arts?
a big people
What
pleaser with a
happened
lot of
first?
insecurities and
Yeah,
anxiety.
yeah.
When
Well,
I
that's something I
started to
do write about in my
compete, I had
book
to
because
face
it's a
those
really, really
issues head
important
on. If
aspect
I
of my life and my
wasn't in the right
trajectory
mindset, I
because
wasn't
it
performing at my best. I
is
started to learn
hopefully
that my value wasn't attached to the
communicates to the
outcome
people
and
reading the
learned the
book
importance of setting small
is
goals and
to
even started
stay
practicing
hopeful.
breath work to
That is,
manage my
if I could
anxiety.
summarize in
What also
one
helped my mental
word
growth
or at
was
least one small
my rehab.
statement to people reading my book is to have hope. There's things you still can do. The strategies need to look differently. And so one thing I talk about is my path to where I am today was definitely not linear in any way whatsoever. I talk about how in my 20s I was very, very unsure. And speaking of your past experiences with working with foster care, that was my introduction to mental health while I was getting my first master's degree out of undergraduate. I worked for a residential treatment for male and female adolescents who were severely and emotionally and physically abused, and so definitely really gave me a preview of the impact of earlier experiences, especially traumatic experience, on people's overall well-being and leading on to later life and how they view the world, view themselves and their interactions and emotional, how they regulate emotions and so forth. So, I talk about how I was in original another PhD program that didn't have to do with therapy, but I was under the breath of psychology, and I ended up getting a master's in there. But I realized that was not my career path, and so I transitioned back to my roots of the clinical component and pursued in my early 30s my PhD in this field, and I tell people all the time that this was the path I was supposed to go to. I believe I
Okay.
had to go through this process, but I definitely found what I feel like I'm
Hmm.
really supposed to be doing in a field that's in line with my purpose and values and skill set. And so, and it's like a second breath and second reset in my life. So
Sure.
that's kind of how that came about. And martial arts, as you speak, I was competitive in karate growing up. I played competitive sports and tennis. And just 6 years ago, I stumbled upon
Okay.
Brazilian Jiu Jitsu, and it was because of my kids, and they were my daughter was
Interesting.
training in it, and I said, this is something I can do, and it was initially a bonding moment between her and I, is because I immediately competed as she did as well. And I haven't looked back ever since, and it's just a part of my life, and it's been a huge game changer for me.
Awesome. I'm gonna pick apart your whole martial arts journey, but I'm curious. So it's Dr. Licuanan. Yeah. Yeah. Okay. I said it right. I I'm
Yeah,
curious
yeah.
what
Yeah.
direction
Well,
you
I
were
went through these
going
different
in
iterations. I was
before
gonna thought I was
psychology.
gonna go into
What
law
did you get your
enforcement,
master's
and
in that
I
wasn't in
went through that
psychology or wasn't
iteration, and then
what
I
did you
was
get
going maybe a
specialized in?
medical
Yeah, go
school
ahead.
route, so I took prerequisites for that, and that wasn't a good fit for me. And so I initially got a master's in psychology in general, and I attained that, and it was with a clinical emphasis. And then I transitioned to a PhD program in industrial organizational psychology, which is a field of work that looks at behavior in the workplace. And these are your human resource consultants. They study human
Okay.
dynamics in the workplace. They create assessments, they analyze data, they collect data and validate data. And so that's a lot of what they do. And it's a great field, just wasn't a good fit for me. And it just worked out um, consequently, we had a counseling program in within our psychology department, and I remembered all the work that I did, and I did have some people along the way that said, "Hey, you'd be a great clinician, psychologist." And so it was a collection of all this data that I'd put together. I said, "I think this is my what I'm supposed to be doing," and I did. And luckily, it was a seamless transition, and haven't looked back ever since. And so I was able to get a master's in industrial organizational psychology, and a lot of the skills I learned there, even though it wasn't the path I pursued, still to this day have influence and impact in the work that I do today as a mental health clinician.
Yeah, that's awesome. I mean, I feel like I've made a lot of changes on my path. But I think I had the general idea of I want a hands-on experience in helping people. I have experienced a lot of trauma, so I can speak from my life experiences. But I've also done a lot of work with a therapist to work through some of that trauma, and then vice versa, working with clients that have trauma, helping them to heal. So I know that that's my path. I know that I could try to do something different, but it wouldn't be as fulfilling. And so trying to make this work, I'm just a solo practitioner. I work remotely and so I see clients from my home office, but I don't. I'm not exactly sure where I want that to. I don't know where I should expand. I think this podcast is reaching a lot of people, especially men, which is ideal, but I want to find a way to be more helpful. So I'll leave that at that and transition into your martial arts experience because I think that's so beautiful that your daughter led you to martial arts, to BJJ.
Yeah, it did. And actually, within my first 2 months of training alone, there was a competition that came up, and she had asked me to join her in it. And this was just 2 months in, and she had been training for like 3 or 4 years. And so I did. And my first tournament, and um, trained hard for it, and actually did pretty well in that first tournament. But it was a really bonding experience. And I have another younger son. He's 10 years old, and he competes. And then my wife trains as well, but does not compete. So yeah, the
Awesome.
whole it's a whole family thing. And so yeah, it's uh, f- for those of your listeners who aren't may not be familiar, jujitsu is a has origins in Japan, and it got popularized in Brazil, introduced there, and that's why there's a lot of judo roots in jiu-jitsu. But jiu-jitsu, meaning the gentle art, is a martial art that was designed for people who may not be of bigger size or strength, but be able to manage and protect themselves, and even um, um, defeat a larger, stronger person by using leverage, ground techniques, and so forth. And I think it's a really, really practical martial art because many times, if you're going to be assaulted, attacked, bullied, you will end up on the ground, or you will be end up where you are being um, secured in a certain form. And so it uses leverage to maneuver out, and even to be offensive in addition to being defensive. And so, but in many ways, just it's been a I'd say it's been a game changer for myself. And usually people don't understand it until they really do it. But on a physical, mental, social, and even a spiritual level, it's been a huge life changer for me. And it's probably the best shape I've been in all my years, and my most mental acuity on that level as well. So
Yeah. I can agree with you. I've had a lot of the same experiences. It's changed my life to find Brazilian Jiu Jitsu, and I also have trained in Muay Thai and wrestling as
okay.
well, but just not as much as Brazilian Jiu Jitsu. I didn't find it until
Oh,
2021.
nice, nice. I didn't. I,
So
I
I
didn't realize you also are actively training in it, and so
yeah. I just connected with you on
yeah.
on I just did that, but that's really the show. The show is that I found martial arts because I knew from Dr. Bessel van der Kolk that martial arts helps to heal trauma. And I wanted to see if this was going to be effective in my life because sometimes science doesn't look at, you know, um, they look at a general population instead of specific populations. And so I wasn't sure if that would help me. And it really did. It changed my entire life. And so the confidence that I've developed through training in jujitsu, I'm not the same person anymore. Like it changes your brain. it really does help to heal trauma.
Really does. It changes the pathways just of what's involved in it. They call it the human chess game. It just
Mhm.
neuroplasticity. It's changed because you're forced to think and maneuver and create new ways, and you roll with the next person. It's never the same, and it just
Right.
what it requires. And of course, a bigger aspect of it is the fellowship and camaraderie. It's I believe I think martial arts in general are very good and help in many ways. I'm just familiar with jujitsu, but the level of fellowship and bonding that it creates. I've talked with a lot of people who were in the military and deployed, law enforcement, firefighters, and they've searched for different sports, athletics, or even martial arts to sort of replicate that level of camaraderie that they attained in jujitsu. Was the one that they had stumbled upon that mimics and creates that level of camaraderie, but also that level of stress that it can induce, and the mental aspects that sort of can replicate what they've been through and navigated through. So
Yeah, yeah. It's enough of a challenge. It's not too much of a challenge, but enough of a challenge to help you grow. But I'll tell you. So I found Brazilian Jiu Jitsu because I was looking for a self defense class. I've experienced abuse throughout my lifetime. This particular relationship I was in was physically abusive. I'd never experienced that before. Getting out of that relationship, I said, hey, I need to probably learn how to defend myself. So I started taking some women's classes. I didn't realize the instructor at the time was a former MMA fighter. So we're learning actual, martial. It's not, I'm from Texas and I was taking self defense classes in Texas. These are very different classes. These were not classes that would prepare me for real life situations. And they were very spread out. There were months in between. I did not feel confident. So now I live in Colorado. I live near Boulder. And finding martial arts in Colorado was an amazing thing because it's everywhere. It's widespread. I can learn from over here, and that's what I've done throughout the past several years. But I needed to find confidence within myself. I needed to know how to defend myself, and then I was invited to all of the members' classes. So I was able to take Muay Thai. I was able to take wrestling and Brazilian Jiu Jitsu, and it did change my life in a way that nothing else has. I mean, I've gone through years of therapy. I've done probably 18 months of EMDR therapy. That's the type of therapy I practice, EMDR. I'm also a CAP provider, ketamine assisted psychotherapist. However, I'm very brand new, so it's not my modality just yet. But um, I so in all of that, I found the most healing in martial arts and Brazilian Jiu Jitsu because I'm training with men. There's hardly any women that ever come to train, which I find to be beneficial to me because who's attacking me? Women are not attacking me on the street. Men are attacking me. I was attacked by a man. That's why I ended up in these rooms. So it's a great benefit for me to be able to do. I was just training last night. Being able to roll with men is so essential to me. And I would like to compete. I plan to do that in the past. Yeah, I was so adamant about competing just a couple of years ago. I was training several times. I was training for several hours a day. So I would go in the afternoon to a different gym, and then in the evening, I would take Brazilian Jiu Jitsu and Muay Thai and then stay later for rolls. So I'd be spending 3 hours at night and an hour during the day because I was preparing for competition. But I sustained a concussion and it hospitalized me. So it was
striking or
from
from
striking.
the
Yeah.
from the okay.
Yeah,
Yeah.
I can't say that I didn't receive like the other injuries that I sustained through Brazilian Jiu-Jitsu. I can't say that didn't influence the concussion. However, I know in Muay Thai, there was just not as much safety precautions being followed that led me to the concussion. So I never got to compete. Yeah.
And just for also, because sometimes people have differing ideas of jujitsu and competition. You don't have to compete to enjoy the experience, and so I just so happen to compete. It's just in line with me. It's what keeps me motivated. It gives me that beacon to strive for. It elevates my training. It helps me deal with stress and increase my threshold of anxiety. Um, um, but it's not for everyone. There's some people that go in the fellowship and to stay healthy. There's some people that do it for self defense. There's some people and competition is just another level that it offers, which is great about it. But you can still enjoy the experience, and hopefully one day you can get to that point maybe where you can get on there and try to compete. But I do recommend with people, for the most part, that if you ever have the opportunity to compete at least once in your Brazilian Jiu Jitsu journey, try to do it. It might be something where you never look back. It's maybe something that, hey, that's not for me, but the level of it, what it does to your whole system of dealing with the anxieties, the pressure, the focus, testing yourselves in levels of discomfort, coming up with solutions, is pretty amazing at what it does to our mind body. So
Hmm. Yeah, yeah. I can't wait to compete. That's what's coming up next. I have 2 stripes on my white belt, and we were up for promotion for both BJJ and Muay Thai. And I think I just was doing too much. I was trying to
you
focus.
don't have to add this
Yeah, go
part
ahead.
in or anything like that. But what school do you train at?
Oh yeah, so I will add this because I just joined a new gym. I just started training at Gracie Barra
Ah,
here in I trained a tiny bit in Fort Collins when I was living up there, but now this one's in Broomfield. So I just joined
awesome.
really this
Good for
week.
you.
Yeah, I took 2 classes last week. Yeah, and now
Good.
I'm an
Well,
official
hey, we're
member.
connected.
Yeah.
I'm Gracie Baja. I'm Gracie Baja
Oh,
headquarters in
really?
Irvine, and so I don't know if you noticed my cup. That's Master Carlos, and so forth. But yeah,
Oh,
I'm Gracie
wow.
Baja, and um, yeah, and so great. It's a great to me. It's a great school, a great curriculum, and so yeah, so great, and glad we're connected that way. That's awesome. I'm,
Yeah, me
I'm preparing for
too.
the Master Worlds. I don't know if you've heard of that, but it's in Vegas. It's the really
Hmm.
huge one, and so been
Yeah.
training hard, and I've been competing in that ever since I started. So every year, I've competed in that tournament, and so my life goal is to win that thing.
Yeah, that's
Yeah.
amazing. I do know that's coming up. There's another competition I think at the end of the year that I can maybe sign up for. I just have to be careful. I have to make sure that I don't push myself
Yeah.
too hard because I am a
Yeah.
competitor. I was a distance runner for 6+ years of
Yeah.
my life, and so I'm used to competing. However, like even back then in high school, I like would just lose myself in it and not make sure that I'm eating enough calories and
I would recommend if you do
resting.
compete in the Gracie Baja CompNet, your local CompNet. And so I don't know if you know what that is, but
Okay.
CompNet is the
Mhm.
Gracie Baja um, in school tournament. And so usually it's your local area in Colorado. Maybe you might get some people from California, but usually it's the Colorado surrounding area. And they have 4 or 5 of them a year, and it's a great way because everyone's similar curriculum and it's a friendly atmosphere but yet competitive. So if you were to get starting off, I would suggest a CompNet before you go to the IBJJF or the Jiu Jitsu World League ones. I would suggest get your feet wet with a CompNet. It's a great atmosphere, and like I said, everyone is on the same playing field because of the same curriculum. So it's a great way to start off.
Well, I think that I made the best decision. I've taken trials at like maybe 6 different gyms. Like I wanted to find the right place because
Mhm.
I can't have a repeat of what
Yeah.
happened. I have to make sure I'm around safe people. And I instantly felt
Good.
welcomed in Gracie Barra. Like it feels like a family. That's what I think it's supposed to
And when you
feel
go to
like.
almost any Gracie Baja, it it's very familiar because the curriculum's the same, the mat's the same uniform, and it's really. And so tell your professor there that you interviewed, a Gracie Baja from headquarters, and Professor Philippe is our head professor,
Oh, okay.
and we're gonna get a lot of visitors these next few weeks because they come prior to going to Vegas for Master Worlds. And so we've been getting visitors. And then ADCC, I don't know if you know what that is, but it's the big no-gi tournament going on in Vegas this weekend. And so we've had a lot of visitors from all different Gracie Baja schools. But yeah, Gracie Baja is definitely a great school, and it does have that family feel to it. And but yeah, by the way, too, and then we can get back. But if you ever want, I don't know if you ever checked on my Instagram, but I started a new series called Dr. Brian's Jiu Jitsu on mental strength. And so I've been doing these brief
Oh, okay.
interviews with people, 35 seconds to 1 minute, just saying how it helped them with their mental strength. And if you look at the most recent one, Krista Lopez, she's from a school called North South Jiu Jitsu in Texas, actually. And she talked about how it helped her with her anxiety, her need to please people. And so if you want to do one like that in your dojo and stuff, I'd love to, because I'm really trying to get more women perspective for women empowerment. And you just say, jiu-jitsu has helped my mental strength with trauma or whatever. And her post got so much views and recognition, and it'd be a great way to promote your podcast as well. So if you ever want to, we could talk afterwards. Let me know,
No,
and
let's do it.
yeah, so I'll reach out to you and let you know more about that.
Hi, my name is Krista Lopez, and I train at North South Jiu Jitsu, which is an Inicio affiliated school in Dallas, Texas. I am a senior financial analyst at Toyota North America headquarters. Jiu-Jitsu has helped my mental health and growth. Specifically, when I started competing, I was a big people pleaser with a lot of insecurities and anxiety. When I started to compete, I had to face those issues head on. If I wasn't in the right mindset, I wasn't performing at my best. I started to learn that my value wasn't attached to the outcome, and learned the importance of setting small goals, and even started practicing breath work to manage my anxiety. What also helped my mental growth was my rehab journey after I tore my ACL at Pan's No-Gi. To be off the mat, so it was really rough, but I kept going to class and doing what I could. That's when I really had to practice patience, humility, and resilience, but it recently paid off when I got quad gold at Austin Open. In general, I think Jiu-Jitsu does a really good job at putting a spotlight on areas that we can grow in, and if you decide to embrace the challenge, I think it'll really help you grow as a person.
Yeah, I'm not trying to preach. I don't think maybe jujitsu is not for jujitsu is for everyone. That's the motto.
Yeah,
However, not
according to
everybody has to be interested in this or willing to take that step to do that. But I have to spread the message. That's why I started my podcast, because it was so effective for me. I have to share this with people. So I'm very open to doing that and any other projects. Yeah. So I'll give a shout out to my professors. Professor Jefferson is also a world champion. I think he's won several times. I think it's at least twice, but he's a sixth degree black belt. Yeah, I know. How
wow,
lucky am I? This was random. I just like said, "Hey, I'll go take a
that's
trial." So
huge.
he's like
Yeah.
the perfect person to prepare me for competition. But I also there's several black belts. I
Mhm.
trained with a black belt last night as well.
Mhm.
I think it's Professor Ian, but I can't pronounce their names. I'm sorry. I'm not
Yeah.
I'm brand new.
Yeah.
I'll get it, but I just want to give a shout
Yeah.
out to them because I feel like I can actually get back to where I was, and I feel like I was on the right track, before my injury. So just wanted to shout out to them.
Mhm.
Okay, so I
Awesome.
I want to transition over to talking about substance abuse, because this is something that has impacted my life throughout my entire life. And I want to find
Hmm.
the best way to approach healing, providing the right information to my clients if that's the route that they want to take,
Hmm.
and to my audience, to the public. How should we view substance use? How should we view substance abuse? And what's the best recovery if we find ourselves in that space? So what's your perspective on
Hmm.
substance use, human beings using substances?
And that's a great question, and that's part of what I call in my book, actually, the 25 must knows. It's the, I believe, 25 of the most essential knowledges, whether or not you are someone struggling with your own mental health, your family members trying to get someone help, a clinician who's new to the field, or a seasoned clinician. It is what I have found based on certain questions that people have posed to me, whether it be in a group setting, a residential setting, private practice, or in the community after I give a talk. And there's these recurring questions. So I call it the 25 must knows. And one of them is that, I'm not against substances, right? Alcohol, marijuana, opiates, of course, illicit drugs like meth and cocaine for sure, because there are some people who can consume a glass of wine and not be a problem. There are some people who can smoke marijuana for pain or insomnia and not get dependent. There's some people who can use a regimen of opiates because of a back surgery and not
Mm-hmm.
transition to heroin, right? And so that's what happens a lot is sometimes people get this impression that we're stigmatizing substances, and that becomes the battle. And I say no, I'm not against those, because like I said, there's some people that can manage it. However, if someone has a family history or a personal history of substance use, abuse, or dependence, if someone has an underlying mental health condition or a current condition, substances provide a certain risk factor, right? And so a mind altering substance can put people at risk. It could make you more sensitive to an underlying condition, can bring about a condition sooner than later, or it can worsen existing symptoms. And so that's one thing we have to look at, is that sometimes people fall under that risk factor umbrella. So that's my general perspective, is that. And the other part of that is, one of the things I talk about in one of my must knows is the three words, the why people will resort to a substance um, as a coping skill. This is what I'm talking about when it becomes problematic. Is three words: is because it works, right, for what it was originally intended. And if you drank a little alcohol to sort of drown out some of your traumatic memories, if you smoke some marijuana to deal with your social anxiety, you take some opiates to feel a little bit more clear headed, you do it because it works. But we know that over time, if you get tolerant of it, the more you use, the less effectiveness, which requires you to engage in more, then it becomes counterproductive
Certainly.
and dysfunctional. And so that's my saying with it. And because we can't deny that it works. And whenever I say that to family members or people struggling, they're like, "Wow." Whenever I ask that, give me three words. No one's ever said because it works. They say, well, to heal, to numb the pain, for trauma, shame, guilt, what have you, which are all correct. But even on a more basic level, because it works. That's why one person will use alcohol versus heroin. That's why one person will use marijuana over opiates, is because it works. And so I think when we recognize it on that level, um, that's important. And of course, our job is to find different options for those people where it becomes problematic: mindfulness skills, meditation, fellowship, therapy, what have you. But that's I think a very important perspective for people to have of why they engage in
Well, I
substances.
agree with you. And I think that it's hard to make an argument with someone that has that philosophy because it works. I mean, I would have to come up
Mhm.
with a solution that works better than what they've already been depending on. So, and I know that a lot of
Exactly.
people in general, not just professionals, but people in general feel that the world would be better off if there was just no substances and nobody used substances. But I don't see that in reality. I don't see that these substances are going to go
No.
away. And in talking to some of my professional colleagues, like you said, marijuana or cannabis has been around for 10,000 years or something like that. There's a history. Um, there's something written in history that cannabis was found in like Buddhist temples, or which to me creates some
Hmm.
um, it's not congruent with what and from the perspective that I was raised in Buddhist environments and meditation, and it
Hmm.
is in
Yeah.
the communities that I was in, it's been very shamed. So I don't know, I
Hmm.
don't know what perspective to take. I guess in this conversation, I'll help. It'll
Exactly.
help to cultivate one, but I'm not sure how to argue with someone that finds that something works that perhaps I disagree with, or their community or their family disagrees with. Is that even a point of should you even be discussing it at that point? Because like a client can come to therapy and admit that there are substances in their life, but if they don't want to work on that, then as professionals we cannot we're not instructed to move forward.
Hmm.
So what do you do in that case?
Yeah. Yeah. And well, one thing you brought up is a very big important part is I've come across that there's that cultural differences, right? I've worked with certain cultures. You talk about Buddhism. I've worked with Native Americans and different cultures where certain substances are used to achieve a certain level of thinking and spiritual connection, and so that's important. So cultural competence, cultural awareness is critically important. So as I think it's very important to
Yeah.
meet the client where they're at, right, first. And one thing that's very important to do, not just in substances, but for any arena, is we want to stay away from shaming someone, because shaming is the root of humiliation, and shaming has been one of the biggest barriers to why people don't accept help. And a lot of times, family members, they, whether it be intentionally or inadvertently, they shame someone, hoping that that may be the path to get them to change their ways or accept help. And usually, what that does is actually polarizes people. Is it makes them feel alienated, alone, and helpless. And so, I think one of the biggest things we have to do is to understand the person of why they use that substance. What does it do for them? And then of course eventually is to find alternatives, and they just feel like a lot of times I find people, I was just talking to someone today, is that person truly believes alcohol is the only way to
Mm.
quiet his traumas, the voices in his head, and and he hasn't found anything else. And as we know as clinicians, there's a lot of different options and effective ones, and our job is to guide them in and help them with that. And I believe that's what I do in therapy, is I can never tell someone they can never do something, or they can never engage in some type of behavior. I just tell them all I could do is give you an option, and to help them examine what the consequences are for
Yeah.
choosing certain options. And when people get help, and you're to answer your question, there are some people out there who aren't ready to accept help, and we just assume automatically that it's because they're resistant, which could be true, but there's some
Mhm.
people who are fearful. It's their life preserver. That's one of the things that I call, and one of my must knows is you are asking someone to take away their life preserver, the one thing or things
Yeah.
that have kept them afloat. And imagine, right, you take that away from someone, that's fearful. And that's what we try to teach them, is there's other ways to stay afloat, there's other ways to thrive. And but it's a dysfunctional life preserver, what I call it. As sooner or later you're going to sink, it's going to sink you. And so I think it's really important to hear where they are at, what their values and goals are, and to really understand
Yeah.
why they turned to it to begin with.
Well, thank you for
So
that answer. I'm as you're talking, I'm also thinking, I don't have to. I don't have to have the right answer, because what's the right answer?
Mhm.
It's really kind of
Yeah.
feeling it out, and meeting the client where the client is at. So I guess let me
Mhm.
shift into what is substance abuse, and then we can talk about recovery. What from your perspective is substance abuse?
Substance abuse is when someone engages in a substance. Of course, we're talking about alcohol and pills and so forth. As we know, there's other ways that people can get dependent on things like food. But for substance, it's when we engage in a substance where it is having an impairment in our life, right? And for example, binge drinking, right? When we engage in more consumption than that is healthy for us, and it impairs things like judgment, decision making, and has some consequence attached to it. That's an abuse substance, right? And so we also go into dependence where we rely on a substance to for a certain outcome, right? To relieve our anxiety, to stay awake, to be more engaged. Okay, and so, but yeah, it's usually it's the abuse is when it creates some type of harm, whether it be a physical, mental harm, individual harm, or even interpersonal,
Mhm.
where it's affecting others. And a lot of times it's where when we get into dependence or addiction, it's when we continue to engage in the behavior, knowing that it's harmful, but
Yeah,
we can't stop doing it, and our life, it becomes our priority, and things like being secretive and all that stuff is where that
yeah.
enters into
Okay.
that realm.
Thank you for making that distinction. So really, I guess my next question is about recovery. What's the best way to recover
Hmm.
from substance abuse, dependence, or addiction?
Hmm. Well, the biggest thing, I think, one of the most important elements for any change, whether it be substance addiction or any change in life, is we have to be honest. I know that's easier said than done, is you have to be honest with yourself and others. Because my belief is, if we're not honest, we harbor secrets. When we harbor secrets, those secrets turn into resentments, which are unresolved anger. And resentments almost always point back at ourselves, no matter what had happened, who did what. And I call resentments the termites of our inner being, or the acid of our
Wow.
souls. It eats away at you. And that's why most modalities out there, religious modalities, 12-step recovery, other type of mental health treatment, looks at resentments, because that's how powerful they can be. But I think it's very important to be honest with yourself. And are we always honest? No. Can we get to be honest by ourselves? Sometimes not, and that's where the family
Sure.
dynamics comes into play. Is we put the person in a situation where they are sort of forced to come up with these awarenesses, and we can still do it from a loving place. And so I think honesty is the most critical element that someone needs to engage in, because if with honesty there comes insight and recognition. And a lot of times, though, what I have found, and someone waking up and saying, I need to stop
Mhm.
engaging in this substance, if I was to give my rough estimate, at least in the populations I work with, that's less than 10% of the time. And usually that happens where maybe they had a traumatic event happen where they lost a family member, a divorce, they lost a job or career, or maybe there's a death in the family. But I would say about 10% of the time, is that enough of an impetus for someone to say, okay, I need to get healthy. Sometimes we think kids will be your driving force. In some cases that is. But where people are really, really deep into it, even that is not. And we see that repeatedly, where people, have substances or other influence while caring for their children in a car or what have you. Usually it is, and that's where the book comes into play, is that the system level, whether it be the family system or whoever is in that intimate system, are the huge deciding factors to put that person in a position where their only option is to accept help if they still want to be part of that family. And most people that I find they want to be connected. That's part of the human condition. We want to be connected, even if it be with one person, whether it be with a friend. But our human condition is to connect. Rarely is it ever anyone that can live like a hermit and be okay and satisfied. That's rare. And so we utilize leverage. And one thing that's important is, there's a saying out there, tough love. Tough love is one of my 20 my must knows, is it comes from a loving place. However, what happens is people can interpret that, and I've had family members interpret it. In my words, I call it, they say, think it's tough luck, that we're done with you, get better. And that's not a safe place to be for someone who feels hopeless, and abandoned. But you can come from a loving place, what I call it assertive love, and it's saying that, hey, we love and care about you, we're here for you, we just can't continue to participate in this unhealthy lifestyle because what we're doing is more harm than good. And so that's the beginning languages that I teach people, to begin to leverage that, where someone is put in a position where they're going to accept help, hopefully and
So
eventually.
I guess correct me if I'm wrong. Is tough love simply just healthy boundaries?
That's what it was originally intended. Is, hey, quit being a part of, co-signing, enabling, or what have you. And that's another word that I talk
Yeah.
about. It's not a curse word, right? Enabling is not a curse word. It comes from a place of love, like tough love. It does. It's just that where I find most people is they conceptualize phrases or words like that in not the most effective way. And like I said, tough love, people say, I'm going to be tough with you, get out of my house, I don't want to have anything to do with you any longer. That is a boundary. Boundary means just communicating very clearly of what you're going to participate in, not. However, when we come that way, when we shut someone out and they're lonely, they're depressed, they're maybe suicidal, right? That doesn't increase
Right.
the chances of them wanting to get help. What we do is we come from a loving place. Like I said, is my boundary is, we're here for you. When you're ready to make a change and get help, we will be here for you. It's just that at this moment in time, with the way you're living, what we're doing is not helping. What we've been doing hasn't been working. We need you to begin to make changes, and we will invite you back, and we'll be there for you as long as you're
Yeah.
willing to make that change. At least an effort and recognition to make that change. And so, no, tough love isn't inherently a bad word. It's just that some people interpret it the wrong way, which can be very dangerous for people. And when someone's helpless and hopeless, their option of ending it all
Yeah.
increases that likelihood.
Well, that this point is really what I want to talk about the most, because in my experience in trying to get
Mm-hmm.
trying to be a savior, trying to save my past
Mm-hmm.
romantic partners, and the many attempts that I've
Yeah.
made, that now I've learned I can't save anybody. It's not about that. However,
Yeah.
I've hit a brick wall anytime that I was making the decision for them. I cared about the recovery more than they
Mm-hmm.
did. However, I found a lot of issue with the programs that my partners would go into. um, they'd
Mm-hmm.
learn that I was a therapist, and communicate with me somewhat on a
Yeah.
clinical level. However, I'm still a loved one, so I'm still needing
Yeah.
the support that every other person, every other loved one gets in those programs. And I found that I butted heads with them a lot of the times around the idea of
Mm-hmm.
tough love, of um,
Mm-hmm.
the whole cutting someone off financially. So we got hung up in a group discussion about the best way to either, be supportive, or what would be considered enabling for your loved one. And I don't find that, alcohol is inexpensive. Most of these substances that we're talking about are inexpensive. Alcohol, you can get alcohol for $20 or less. So cutting someone off financially
Mm-hmm.
that is perhaps experiencing homelessness, or um, not, they don't have their own income. Cutting them off financially would also
Mm-hmm.
mean they couldn't meet their other needs. I'm not sure where
Got
tough
it.
love lands in that type of discussion, because
Yeah,
it's not really
I know.
stopping them from desiring the alcohol or getting it otherwise. It's kind of
Mhm.
creating distrust in the relationship.
Yeah, yeah, and that's a great point, and that is a very common question that came upon in my groups. And again, one of the must knows is that uh, one of the things that's important is, I believe, that we all have a threshold of sort of a gas tank. And what happens is I get a lot of families in my support group that say, "Well, my son's homeless or my daughter's homeless. Yeah, I just give him like $5 a week and so forth, or I give him, I bring him a meal, or we get my daughter a hotel room, like at least on the weekends." And one of the things that they don't realize is it doesn't take much when someone's at that level
Sure.
to fill their gas tank, and so to speak. And what it does, it in many ways it can perpetuate, and it doesn't put them a point, what I call a point of desperation. And I know it's very hard. One of the things real quickly that I mention is that the three inevitable consequences of untreated mental health or substance abuse disorder, especially when it's a high level,
Mhm.
is people end up in jail, they end up in hospital or institutionalized, or they lose their life, right? Homelessness is temporary. If they don't get help, they'll end up in jail, hospital, or they lose their life. And not only that, that they can also harm someone else or create, breakups in families and so forth. But I tell family members, you have to accept, not emotionally, but you have to accept the reality that your loved one can lose their life if they don't get help. And because that's where most people stay stuck, family members, is that what they'll do is, like, for example, well, I know my daughter, I know she's in the guest house, and I know she's, drinking alcohol all day and drinking opiates, but as long as she's not on the street getting trafficked or abused, or I know my son or grandson is, I know he's in that apartment, and I know we give him some money, I know he's not going to school and he's using that money for smoking marijuana all day, but as long as he's not
Mhm.
wandering the streets at night. And what we're doing is we're prolonging, the longer that someone stays in that certain lifestyle, the harder it is for them to get that awareness or that aha moment and to make those changes. And so we have to accept that that's the biggest thing we have to accept when you're at that level. Now, this isn't, just to remind you, this isn't the go-to. What I'm referring to, these tactics are people where they believe they've tried everything. The person is completely resistant and they're in imminent danger that if they don't do something right away, that something bad can happen. But still, you can still use some of these principles and boundaries for people who may not in crisis mode, but they're elevating to that level. And so there's a spectrum. I believe everything's on a spectrum. I believe every individual case is different. But these interventions that I use are for people where we tried to collaborate. We've tried to motivational interview them and help them along the way. And they're just at a point where I'm done, nothing, and families are concerned. And so that level of desperation, when you put a level of desperation, you either fight,
Sure.
flight, or freeze. And fight meaning, okay, I'm ready to take this on. Freeze, okay, I don't know what to do. You're more likely maybe to accept help. But sometimes people flight and they still have gas in their tank. And so what I help families do is we have to drain that gas tank. We have to drain that gas tank, because when we're at that place is we're more open to direction. And also one last thing too is I believe there's a window of 30 to 90 days, where if you can get someone in a 30-day window of getting help, clarity starts to happen. They start to get off their substances. Maybe they treat medicinally, maybe they eat better, sleep better,
Mhm.
and they can get out of that unhealthy thinking. I've had people who literally said, I'm going to kill my family when I get
Oh.
out of here. Obviously they're in that stage, they had meth in them, they were manic, and all of a sudden 2 weeks later, families are part of the group and they're having reconnecting again. And so that's what I focus on, is we have to get people in that critical window of 30 to 90 days where their brain can start healing and they can distance themselves from that unhealthiness. And you'd be amazed at the clarity that people have. I've had people who were homeless and had no worth in life and were suicidal, and when they got healthy, all of a sudden they have worth in life, they have hope for the future, they reconnect with family. And so I tell people this disease can fracture families, and I've seen it happen. But the recovery process, I've actually seen dysfunctional families become closer than they were prior to treatment is because of every individual responsibility and the things that are involved in a recovery
Certainly, yeah.
process.
I'm going to drink some water too before I respond. Good to take little breaks. I think that um, with all of the approaches that I've been presented with, I think that that one in particular has come up in my family and other relationships, that one is the most
Hmm.
it's hard to find a balance of what you can give and what you shouldn't give,
Hmm.
perhaps, to help
Yeah.
somebody in their healing. But I think the best approach is I don't want to completely just throw dirt on these programs, because I know these uh, rehabilitation programs are designed to help people, but I
Hmm.
don't feel that most people find long term, like sustainable recovery. I find that a lot of people come back to these programs. I've worked in these programs and I've seen the same people come back. And I think that
Yeah.
now we're moving in a direction of looking at mental illness through the lens of trauma. And how do we address the
Hmm.
trauma? Because a lot of people ask why the substance, but Dr. Gabor Mate says, why the pain? That's what we should be asking, is why the pain and addressing the pain.
Yeah.
So my approach is to address the
Hmm.
trauma and not focus so much on the substance, because I find that when we're focused more on the problem, when we're more problem oriented or focused, at some point, we're creating more of that problem that we may be able to manage later, but our focus is let's get somebody at a different baseline as quickly as possible. I don't find
Hmm.
that to be as effective for the people that I've worked with and have been in relationship with.
I agree with you, and that's the very important part, is getting those people into that window, that opportunity of window, because um, um, and yes, exactly, because substances or whatever else, the coping mechanism, food or hypersexuality, gambling, or what have you, is yes, it absolutely is a sophisticated way to mitigate or lessen the pain. Right? There's a saying, not my saying, but I can't quote where I got it from. But I've had this saying for some time. But the degree of one's coping mechanism is directionally proportional to one's
Mhm.
degree of pain. I'll say it again. The degree of one's coping mechanism is directly proportional to one's degree of pain. So remember, directly proportional means as
Mhm.
one goes up, the other goes up. If one goes down, the other goes down. So the degree of someone's using, whether it be a healthy or unhealthy coping way, whether it be, like I said, a substance, or maybe you're going to the gym
Yeah, too
multiple
much.
times a day, or you're doing something else, you're overeating or undereating, what have you. The degree of one's coping mechanism is directly proportional. So that means that they're in some deal of pain. And absolutely, I agree with that. To me, I get families, well, what came first? Is my daughter depressed because of her alcoholism, or does she have alcoholism because she's depressed? I said, it doesn't matter what came first anymore, the chicken or the
Yeah.
egg. They're both impactful. And so, but I agree with that. Focusing on the problems, it's focusing on the solutions and the reasons why, and finding alternatives. And the last thing, too, that I wanted to say with this is, one way to set the boundary is, I believe that I have learned over this past 4 years, is when you take away the element of choice from people, or the perceived deprivation of someone taking away my choice, the
Mhm.
human condition resists. You do that with a young child, you
Yeah.
get off that or else, right? Rather than give them options. And but that's the same model with these loved ones, is that, what are you're kicking me out of the house? No, we're just saying that if you continue to engage in those substances, we can no longer have you stay at the house. But you're not going to give me any more money anymore for food. I said, no, that as long as you work with some of these things that we want you to do, then we'd be more than happy to support you. And so it becomes this bartering that you do, and it's not a holding over your head that, okay, you don't do that, you're not getting any money. but it's giving them empowerment that they still have a choice. And I think that's really, really important because ultimately they're going to have to make a choice. And I think if we stay away from making them feel as if they have no choice, they still have a choice. Yes, I can be homeless and use and not have my family support, or you know what, I can work on curbing my use and have my family back into my life and get that support and work with them on that level. And so I just really want
Sure,
to
sure.
reiterate that aspect of is we have to empower the client and allow them to know that they have a choice. We're just communicating what choices we're going
Yeah,
to
yeah.
support, not support.
I think that that's helpful, and I think every family is going to be different. Every family dynamic is different,
Mhm.
and I can speak
Yep.
on mine. I've spoken about my family dynamic a few times on my podcast, and I did not come from a healthy background, and currently my family
Okay.
dynamic is very dysfunctional, and I find that the people in my family that have struggled the most with substance abuse and addiction um, did not um, believe that therapy could be a healing modality. They did not lean into
Hmm.
that, and perhaps leaned into religion um, as 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 healing, and did not find that to be very effective. And I so really what the perspective I'm coming with is that I don't feel like every family dynamic is able to provide that healthy tough love that you're describing, because the family in itself is dysfunctional. And so again, my perspective would be the trauma. Like I can't go to a family member that I've been separated from, or I can't think of the word, just not in communication with, and get the support, theoretically, get the support that I need in healing, because they can't be supportive in other ways. That's really just my whole family. So in
Hmm.
those instances, what does a patient do? What does a person do that is trying to find
Hmm.
recovery?
And again, this is where the guide comes from. I mentioned earlier family crisis intervention, and this is not the same intervention where we sit the person struggling in a room and we tell them that we love them and that they need to get help. No, this is the step before that. The family crisis intervention is that support system. It requires vetting who's going to be part of that initial phase of treatment and what help they can get. Because if they're not going to be a part of it, I call it the primary support system, or actually the coalition. The coalition are those core people in what I call phase one of and phase two of treatment. Phase one is 30 to 90 days. Phase two is 3 months to 1 year. Those are the most critical people who are going to have a unified vision, and they're going to be unified in the goals and the plan. And so, yes, the family crisis intervention is saying, hey, dad, what's up here? You know what? You're drinking alcohol and you're asking your son, you're using alcohol and you're asking your son to
Hmm.
get sober, right? We need to look at that. Hey, mom, yes, I know you've had abuse and you stonewalling your daughter because she's
Yeah.
that's we need to work on that. So everyone, there's a saying, I like to use a rowboat analogy that I do is if you've ever rowed in a boat, right, is that and you want to get the best speed and distance is everyone has to work 100% with four people in the boat. They have to assume 25% responsibility and work 100% on that 25%. That doesn't mean everyone is equally athletic and strong and have the stamina, but everyone has to assume equal responsibility. Because what happens is people say, well, gosh, no, he's the one that's messing up. All that he's got to do most of the work, or one parent is doing most of the rowing and they get burnt out. And so in the family intervention, that's what I help people do is recognizing what their share responsibility is, and they have to work 100%. That's the family crisis intervention that I talk about. If I may say one more thing too, I talk about how to get your resisting loved one to treatment. I chose that title because I believe it'll get people. But one thing, it's a keyword for some people. But one thing I want to differentiate is treatment doesn't actually mean formal treatment.
Sure.
You have to go to a residential treatment center because you're right. There are some religious modalities that have their approach to it and other things. But how I also say is how to get your resisting loved one to start beginning to accept help. That's what it means as well, is because hopefully they're, how you look at the most effective treatment, getting them to a place where they can start to accept help will help them in a pathway of getting the kind of treatment or help that they need. So that's sort of want to
I
clarify that as
appreciate
well.
that. I feel like this is one of the most important topics, like of our time, of our lifetime. I think that
Mm-hmm.
people finding empowerment and other resources, whether it's martial arts or BJJ or any
Mm-hmm.
other creative expression. So, like, I created a podcast. This is a creative expression, if it's singing or dancing, or I feel like if somebody is struggling with substances, I instead of focusing, from my perspective, instead of focusing on getting rid of the substances or that problem in general, at least add other other resources to your
Mm-hmm.
toolkit. You know, as we say, like,
Mm-hmm. Yeah,
lean into things that maybe you haven't tried before, or things that you are familiar with that you do find joy in, focus more of your attention on that, and then you can maybe return to the substances and how do I change behaviors here. But I find, like, if you're saying, if somebody's in a situation where this is their lifeline, this is their survival, maybe let's not touch that immediately. Maybe we should substitute, maybe we should add to their toolkit,
exactly.
so that they don't feel like they're in a life or death situation, and then address the substances.
Mhm.
So yeah, that's all I want to say about that, but I really appreciate your feedback. Yeah,
Good. That's,
i got I got to get your book.
yeah,
I'll order it, and maybe by the time I release this episode I can give some of my feedback on your book. So
absolutely. I would love to hear that feedback, and I'm really, really, really open to that. And hopefully that there's little
sure.
nuggets of knowledge that's what I want to do. Is I wanted these little take homes, um, that these little statements or these take homes or
Mhm.
a different way of looking at things. And so a lot of what I do also, like I said, is I reframe certain terminologies that are out there that are well meaning, but they're misinterpreted, that I find a lot. And like I said, enabling, literally enabling is a curse word. You say that word and like, oh, stop enabling, but people don't really know what that means. But enabling comes from a place of love. That's what we do as family members. If someone's hungry, we give them nourishment. If they're homeless, we
Mm.
give them protection. And but it
Yeah.
perpetuates the problem, right? And so there's a saying that goes along with that is, when I ask family members, like, oh my God, my daughter's been drinking alcohol for 10 years. She's been in and out of certain treatments and sober livings for so long. I said, well, do you know the reason why your daughter can continue to struggle all this time? I said three words, right? And the three words are, let me ask you, what would be your three words, simple words of why, in that example, that their daughter can continue to struggle and over
um
again?
I know what you've shared with me before, but I would say because she can.
Because she, very good, because she can,
Her
exactly that,
freedom to do
because
it.
it works,
Yeah.
for
Yeah.
why these, because she can, because on some level she's getting the communication and a systemic level that either her problem's not that bad or people
Mhm.
are condoning it in her thing. And what happens is that's what happens a lot with family members. They start to go in this acceptance. Well, that's just who he is, or we can never change, or she's too far in. And that's where I try to tap in with families is, no, there's still things you can do. Neuroplasticity, the ability for our brains to heal and change and create new memories. And that's a very promising concept to a lot of these family members, because they think, well, gosh, he's 50 years old, is he going to change? And that's what happens is we have this submission. Well, they're never going to change now. They're 60. They're never, oh, wow, it's too late. It's 70. But they've been saying that since they're in their 20s. And it's never too late to change. I've seen people in their 60s finally get sober and have a huge new chapter of life. I've had people, and homeless and down and out, and still make changes in their life. So it's never too late to make a change, and there's ways to still make changes. So it's an important message that I want to communicate to
Certainly. And
people out there.
I just want to say, because you brought up the word enabling, I've shared with the public
Mm-hmm.
that my addiction, or the what I've struggled with throughout my entire life, is codependency, and that's basis of enabling
Mm-hmm.
is just I'll do it for you.
Mm-hmm.
I'll save you. I'll
Exactly.
make this relationship work, although you're not putting in the work, and
Mm-hmm.
that's a
Yep.
terrible disservice to both parties, and
Mm-hmm.
will really keep you behind in life. And so through my recovery of that, I mean, in part of my concussion, sustaining my concussion, was part of this dynamic I was engaging in. I knew that I was not in the best environment
Mm-hmm.
because there's a lot of red flags. There's red
Mm-hmm.
flags from the beginning, and then before I sustained that injury. And really, what I should have left, and maybe I wouldn't have sustained that concussion. But I just I knew my voice wasn't being heard. I knew that I wasn't safe, and I
Mm-hmm.
knew that there were other people that had a different agenda. They were not happy about me getting promoted and thriving
Got it.
in this. They were not comfortable with that because I didn't grow up training in martial arts. I didn't have any exposure.
Mm-hmm.
So I'm brand new, and I'm really
Mm-hmm.
progressing very quickly while going through a lot of
Got it.
crises. I was in a massive wildfire just a
Got it.
couple of years ago. I mean, and
Wow.
I
Yep.
continued to train. Let me tell you this. I'll say this and then I'll ask my last question. I continued to train in 2022 after the state of Colorado had never seen a wildfire this big. I think it was $500 million worth of
Mm.
property damage alone. Like the whole metroplex kind of stopped. This was in the winter time, so December 30th of
Okay.
2021 to the beginning of 2022.
Wow.
I I didn't want to stop my training, and in January, they shut off our water. So I didn't even have running water for a period of time. It was
Wow.
2 weeks' time, but my neighbor did, thankfully. So she allowed me to come and take showers after my training, but I just kept going. And I think that that in
Wow.
part just communicated that I'm serious about this. I'm an athlete. I'm taking this serious, and I
Mm-hmm.
have respect for these arts that I'm training in. And so, I my
Mm-hmm.
dedication. I was just focused on what I wanted to achieve, and my blinders were turned off. The sensations that I was getting
Yeah.
from my intuition, from my gut, telling me, "Hey, you're not in the right group." Some of these people support you, and some of
Got it.
them do not like that you're progressing. And then one of them injured me. So
Exactly.
I just have to say that I found a new path through codependency, that I don't need to people please. I don't need to save anybody. I need to focus on making sure I save myself.
Exactly. Got it. Yes. Great, great aha moment. And sometimes I think the biggest aha moments sometimes are some in these situations. And not that I want you to get a concussion, but I think there was awareness from that. That's exactly what you're supposed to do is you take what you can from it and you learn. As you know, in martial arts, you either win or
Yeah.
you learn. That's it. Right. And too many times people stay stuck in the loss or the setback and they never progress forward, or at least it takes them a long time to do that. And so just like any role, you're going to get tapped out. You learn, how do I not get in that position again? I remember one of my first professors, he said, you get stuck in a triangle for the first time, good. You get stuck in a triangle again, what's going on? And he said, you get stuck in a third time, what's wrong with you?
Yeah.
Is because you're not learning. He says you're not learning. Doesn't mean, and if you're doing the same thing over and again. And so, but I'm glad it's been really impactful for you, and it just shows your resilience and another testament of when we're passionate about something that that we'll do anything to protect it. That saying that I said earlier: the harder you work at something, the harder it is to give it up. So,
And all of
but
that drive
good.
goes into my self-healing and self-development. So
Hmm.
I have
Yeah,
to ask, I didn't ask you before, doctor, what belt color are you? You're a purple
I'm a
belt.
purple belt.
Okay. Okay.
purple belt. I'm a three-stripe purple belt, and been training for it's my 6th year. And yeah,
Okay.
and
Well,
so
I'm going to ask my last question, but I've challenged my
okay.
other guests to sparring or rolling. I'm going to do some traveling, so I will be coming to California at some point, and some international travel as
Oh
well.
yes.
But I'd like to have a roll with you if this is something you're comfortable.
I would absolutely love that. Absolutely. I would love to do that. And yes, visit us at the headquarters. We'd love to have you. We're so welcome to visitors. And um, I think our professors do a great job, heading up by Professor Philippe, with creating this very, 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 very welcoming
Yeah.
culture there. Professor Philippe, you'll never guess that he's a beast on the mat because he's always smiling. He greets everybody, every student, shakes their hands, hugs them, every parent that he comes across. And but you never know that he's a monster on the mat. But so I'm really really happy, especially when you find something, because when you find something that culturally fits for you, whether it be a group of friends, and here in a training place, it really makes it feel like home,
Mhm.
and you want to protect that. And so yes,
Yeah.
absolutely, come visit us. Would love to have you, and we'll welcome you definitely with open arms, and I'd
I
love to roll
strive
with
to
you.
be like your professor. I want people to feel welcomed by me and approachable, but I
Yeah.
also want to do some damage when I need to.
Yeah, exactly, exactly, exactly. That's him for
I'd love
sure.
to meet him. Okay, well, I'm going to ask my last question, but Dr. Licuanan, is
Okay.
there anything you want to promote? I think I noticed you have a website or, um, yeah, yeah.
I do have a website. It's drbrianlaquanan.com, and I'm assuming you're going to maybe put that somewhere posted there. But yeah, that's where I have an excerpt of my book there. I have all my media appearances, articles, and things like that nature. So feel free to go there. And Instagram, I post a lot of my podcast, mental health shorts. I do a little jujitsu talk in terms of I mentioned to you earlier. I've been interviewing fellow jujitsu practitioners and competitors on the impact jujitsu's had on their mental strength, and it's really, really humbly gotten increasingly popular among people, and because they can relate to it. And so, yeah, feel free to check that out
Yeah,
as
you're
well. But thank
welcome.
you.
Thank you. I will put all of that information in the details on this podcast, and I'll do a lot of promoting. We'll do a lot of promoting once we actually release the episode. So, so my final question, because my show is called Freedom to Fight, is what does freedom mean to
Hmm.
you?
Good question. Good question. Freedom to me, the first words that come to my mind are the ability to have choice. I think that's huge, is when we have the ability to choose. To me, it really exemplifies what freedom can be. And sometimes we are held back, whether it be explicitly, whether it be that's just a culture, to a family, or sometimes we restrain ourselves from thinking that we can't choose and behave. So when someone feels that they can choose to set a boundary, they can choose what relationships they're going to be a part of, they can choose to wake up and decide what type of life they're going to live today. To me, that's
That's
freedom.
so beautiful. Oh my goodness. I'm going to tear up because that's what your intention is with these families and the public is to provide people freedom.
Yeah.
So that's really beautiful.
Mm.
Thank you so much for coming on my
Yeah.
show.
Thank you.
That really did touch me. Yeah, I will.
Thank
Yeah,
you.
go ahead.
Thank you, Nir, for reaching back out to me and providing this platform to reach out to people.
Mm,
And you're very inspiring as well. And your journey, and how you continue to fight. And that's all we have really, is to stay in the fight. And that's what I'm trying to communicate to family members: stay in the
thank you.
fight.
Very beautiful. Thank you.